substance use disorder, addiction, and recovery. I think why I'm so excited about this particular broadcast, and I've presented many times on recovery and addiction, substance abuse disorder, and even have a handful of broadcasts in our library that you can refer to, is because I really wanted to talk tonight about the thinking that goes into it. What I want is, I want parents to be able to recognize, first of all, in others, what it sounds like when somebody is acting in their addiction versus what it sounds like when somebody is acting from a healthy place. It's not so that you can have this kind of fine-tooth judgment about people, but that you can recognize it when you see it. And of course, I'm going to talk tonight about recognizing it then in yourself, because that recognizing in others can be a step into it. The other main point that I wanted to address tonight, and why I chose this topic, substance abuse disorder, addiction, recovery, is I think that there are distinctions amongst the definitions of these terms that are unimportant. A lot of people ask me the cause, a lot of people ask me where my child or where an individual is on the stage, and the fact of the matter is, so much of our response as parents and as treatment professionals is the same regardless of where they fall on the continuum. So I'll talk about the diagnoses, but I'll talk about it or set that foundation in order, in some ways, to strip away the value that we place on the disorder or the severity of this disorder. So I'll talk about the addiction, the idea of the Diagnostic Manual's definition of addiction, which is really substance abuse disorder. There has to be some kind of tolerance. That doesn't take a lot, actually, for most people to build up some kind of tolerance, but the tolerance can be severe and life-threatening. We hear so often, for example, with opiates or benzodiazepines or alcohol, we hear so often from our clients and families that the level of intake is so severe and the person seems relatively unimpaired at times, but the dose can be, of course, life-threatening. There's some kind of withdrawal. There's obviously physical withdrawal with some of these things. Some of these are deadly. Benzodiazepines and alcohol can have deadly effects in terms of its withdrawal, whereas some can just be tremendously uncomfortable, something like an opiate or other drug. And again, a lot of parents ask questions about things like marijuana. You know, most of the literature talks about marijuana not being something that you can become physically addicted to, in the sense that you go through physical withdrawals. But in my experience, when you remove somebody's drug of choice, whether that be a process addiction or a drug that doesn't have that level of physiological addiction, that there are evidences of tolerance, of withdrawal. And a lot of times it's agitation, it's moodiness, it can be depression, severe anxiety, and that can level off after a while. So again, tonight I want to broaden our idea about these. There's this kind of sense from parents that I've dealt with over the years that if they can more narrowly define things, causes, cures, diagnosis, that somehow it gives us a sense of control over it. And my work is to pull back and broaden it out. So think about withdrawal more vaguely. I used to talk about withdrawal in my group often with my boys as the feelings of missing home or homesickness. Oftentimes they were drawn to things at home that they showed very little affinity for when they were at home, like their family or their bed, whereas they weren't at home a lot, they weren't spending a lot of time around their family. But I think it was the best way that they had to put into words, to verbalize this feeling of unwellness, this feeling of emptiness, this feeling of loss. So I think it's important, or valuable, I should say, for us to broaden our ideas around things like withdrawal. Using larger amounts, of course, for longer periods of time than intended. Persistent desire or unsuccessful attempts to cut down use. There is a lifestyle, right? People that use opiates talk about the lifestyle when they're intravenous users around tying each other off. When I was a teenager, the obsessiveness with which we thought about making our pipes and our bongs and our joints was something we talked about all the time, that we weren't getting high. So it can be something that becomes a part of your culture, right? It becomes a part of everything that you do. Social, occupational, and recreational pursuits are given up or reduced because of the substance abuse. And then uses continue despite knowledge of the related harm, either physical or psychological or social. That's the element. I'm going to talk a lot tonight about self-diagnosis, and I'm going to do something hopefully to liberate all of you from the need to be experts about your child's addiction, right? To be expert diagnosticians as your child's parent put you in an untenable role, a role that you can't fully actualize, you can't be perfect at. So this will be the most technical slide that I'll be reading tonight, but this is what the Diagnostic Manual says about the substance abuse disorder. And for there to be mild substance abuse disorder, 2 or 3 of the following criteria have to be met. For moderate, it's 4 to 5, and for severe, it is 6 to 7. So I'm going to read them one by one. Number 1, taking the opioid or drug in larger amounts for a longer period of time than intended. Wanting to cut down or quit, but not being able to. Spending a lot of time obtaining the drug. Craving or the strong desire to use the drug. Repeatedly unable to carry out major obligations at work, school, or home due to the drug use. Continued use despite persistent or reoccurring social or interpersonal problems caused or made worse by the drug. Stopping or reducing important social, occupational, or recreational activities due to the drug use. Recurrent use of drugs in physically hazardous situations. Consistent use of drugs despite acknowledgement of persistent or recurrent physical or psychological difficulties due to using the drugs. Tolerance as defined by either need for markedly increased amounts to achieve intoxication or desired effect, or markedly diminished effect with continued use of the same amount. Withdrawal manifesting as either characteristic syndrome or the substance is used to avoid withdrawal. So it doesn't apply, of course, when you have medical supervision. So you start to get a sense. It's pretty common sense. Negative effects, increasing use, problems in your life. Of course, what happens for the addict is a level of denial or rationalization or justification that they're unable to reason with themselves. And so for a lot of parents or loved ones, what you try to do is get them to reason. You talk to them, you debate, you argue, you cite points, you justify your own opinion, but you cannot reason with the drug addict. There has to be for them some kind of event or circumstance where they recognize their powerlessness over their addiction. I'm unable on my own, without help, without somebody else to lean on to help me to be able to do this myself. And I can't manage it by moderation or by harm reduction. So the question, how do you know if your child is an addict? And the answer is, you don't have to answer it. You don't have to answer that question. In the 12-step version of this, the only important diagnosis is self-diagnosis. You can be uncomfortable with your child's substance use. You can be uncomfortable supporting the lifestyle. You can be uncomfortable with it in your home. You can be concerned about it. And that's enough to establish a boundary in your home. Of course, if they're younger than 18, the boundary might be, here are the consequences, here are the limits. Eventually, it could lead to a placement in treatment like Evoke. Or if your child is over 18, you can say, I'm not willing to support it. And you can really give them 2 options. I'll support you in treatment if you're willing to get help. But if you're not, you can go this on your own. But I'm not willing to support your experiment anymore. And when they come back at you, either adolescent or young adult, or spouse for that matter, and try to debate with you whether or not they have a problem, whether or not they are an addict, ideally you're not going to engage in that because that's not your point. You don't have to make that point to establish a boundary. And they'll try to pull you into some sense of obligation on your part, try to establish that you need to have this standard where you prove to them that you're right and they're wrong. But again, like a lot of the work that I do around boundaries, it's not about being right or wrong. In fact, I say to parents all the time, you don't get to be right anymore in this way of thinking. You just have to be you. And that could be around anything. Start to ask yourself, what is my relationship to this issue? When we think about co-participation, what's my relationship? Am I the cause of it? And again, thinking that we're the cause of it, then the problem becomes as we remove the responsibility, the accountability on the part of the addict. Even though we believe it's a disease, that it's fantastically affected by trauma, it doesn't remove their responsibility to do something. Somebody that, for example, might have diabetes, that might be a genetic predisposition. It could also be brought on by lifestyle. See trauma. It still doesn't remove the obligation of the person to seek medical care, to improve their diet and exercise, and to take the medication that will help. So we don't have to create these unnecessary dialectics with our children. The idea of the disease is that it suggests a kind of empathy for others. It also suggests to the individual who might be suffering from it that there need be a high level of vigilance, of work, of action in order to counteract this disease. So no judgment, lots of empathy, and an invitation or a requirement to do a lot of very, very specific, difficult, and important things. And then to ask yourself, what is your addiction? What is your disease? One of the biggest things that you can do, it doesn't matter, there's a lot of parents on here tonight, and it doesn't matter if your child has a substance abuse issue or not. The most valuable thing that you can do to positively impact your child, to more successfully encourage and invite your child to change, is to focus on your disease. I like to use the broad umbrella of codependency because in my experience, we all fall somewhere on that continuum. And so if I can, with my children, and I have 4 of them, if I can work on my reaction, my desire to control, what they feel, what they think, what they believe, what they do, how they perceive me, if I can attend to all of those things constantly, my patience, my impatience, my reactivity, how I judge, how I shame, how I intimidate, how I badger, how I nag. If I can focus on all of those symptoms, all of those issues that fall somewhere under the umbrella of codependency, not only am I going to find greater peace and serenity for me, be a more clear, I guess you could say, vehicle of change for my family, but I'm going to be more effective at encouraging and inviting change in my child. And it's not about some kind of shameful, self-abusive diagnoses. I say it sometimes with the families that I work with, it's really just part of the equation of being human. I say to my families all the time, your child had the unfortunate circumstance of being born to human parents. And with that, humanity comes imperfection. So make that your project. Talk about it. And begin to respond to the issue. This is really important. Begin to respond to the issue of boundaries in your life with your children, whether they're more on the severe end or the lighter end. In terms of self-care, this is what I need. This is what I feel comfortable with. This is my stance. Oftentimes, parents want to say, I'm doing this for your benefit, for your own good, or you need this. That can be debated, as all of you know, ad nauseum. But if we can operate from a boundary place, a place of self, a place of awareness, a place of humility, a place of openness around our own issues, it's very difficult to argue with. And when people do try to argue with us, it's a lot easier for us to get out of that. Addiction is not about the stuff you put in your body. I have families, thousands and thousands of families over the last 2.5 decades who have argued for the difference in their child, in their family, because whether or not there are substances being put in the body. I've had people say, well, at least he's not an addict. I've had others say, well, when the substances aren't there, he's healthy or she's healthy. Or my child has autism spectrum disorder. Or my child isn't using severe drugs, right? The fact of the matter is that there are core concepts and principles about being in a relationship with our children, with others, that are the same no matter what the issue is, no matter how healthy or where they fall along that continuum. And so what we pay attention more to is the thinking, right? When I'm talking to parents and they're trying to make a decision around, for example, a boundary with their child, I pay so little attention to what decision they're making versus what I heard you say was, and here's the thinking that I'm hearing you reason with, and that's going to be a problem. I had a parent who decided to give their children a few $1,000s. The child had a gambling addiction, among other addictions and issues. And the child complained that some of the money they'd been given for gifts, that those weren't given to the child directly throughout adolescence and young adulthood. And although the parents had provided very, very generously throughout their life, the parents said to me, what if we just give them the few $1,000s? What if we just give that to them? Just to take that argument away. My response is, I don't think it'll make much of a difference one way or the other. I could easily make a case for not giving it to them. It's kind of irrational. I don't know if you're going to be able to ever prove to your child that you're fair, and that's kind of what they're arguing. But if you need to do it, go ahead and do it. Of course, they gave them the few $1,000s. Less than a couple of weeks passed, and the money was gone. So they kicked the can down the road a little bit more. When the parent says, I'm going to take them home because we can love them, or if I say it just in the right way. Yes, I want to teach parents how to communicate assertively and effectively. When I'm having lunch with friends, when I'm sitting around in the world talking to people casually, socially, my ear has a certain kind of attunement to it, that I can hear things that reveal a certain sensibility. Parents have opinions about their children's thinking. They have opinions about where their children are going in life. They get very excited about when their children are going in directions that they value, that they believe in. They get very discouraged and anxious when their children are going in other directions. I can hear that constantly. And I also hear along with that an inability to remain separate from the child, from the other. Arrogance is not the right word because that has kind of a moralistic tone to it. But there is a lack of awareness of the concept that you don't know anybody else's truth. It's hard enough to maintain and work on yours. So this work, folks, is you. And if we do this right together, if we do this work right together, and you make your work your project, make your truth your project, stop making others your project. Not only, like I said earlier, will you have greater peace and serenity and clarity, and all the gifts that come along with that, but you'll be an earth mover. You'll change lives. You'll make a difference. The orbit that surrounds you will change. People will have to respond to you differently, uniquely, than they do other people. So it's the thinking that goes into it. That was a little bit of a tangent, but the thinking that goes into it. Rationalizing, denial, justifying, and projecting. And here's the problem with that. Self-diagnosis is important. Yes, we can challenge others as therapists, as sponsors, as mentors. Sometimes as parents, if you're lucky and you do it very infrequently, you can challenge it. But the fact of the matter is you can't reason with these people. So you hold your boundaries. You take the right and wrong out of the equation. You don't argue or debate your point of view, right? You don't say, talk about the virtue of your position. You just say, this is what, it's almost like you're arguing for, I just like the color gray for my walls of my office. Right or wrong or indifferent. It almost has that value to it. The peculiarity, this is a great quote I found, the peculiarity of addictive thinking is the inability to reason with oneself. The question becomes for the addict and for the codependent in their lives, what's it going to take? What's it going to take for the addict to realize you can't control this? What's it going to realize for the parent that with all of your best efforts, you can't control them? And you know, as a therapist, I feel passionately about this as an Evoke clinical director and as a therapist for other people. It's my job to sit with you until you're ready, and to be compassionate and patient and understanding and empathic and gentle. I was thinking about this tonight in preparation for this. It's so easy for people to be judgmental. It's so easy to sit on the sidelines of anybody else's life and make judgments. And for me, the only thing that has afforded me a perspective where I feel less inclined to do that is sitting in my own therapy for the past 20 years. And knowing how long, how painful, how difficult it is to make change. That's not an excuse. It's the reality of everything I've seen as a client and everything I've seen as a therapist. I wrote a blog just the other night that's on my website, drbradreedy.com, on what it means to discover the self and the long road in therapy. That's what gives me the patience for others, because I know academically, intellectually, I realize things years, decades sometimes, in advance of me being able to make significant progress in that area. So the question becomes, what's it going to take? What's it going to take for it to be different? What's it going to take to try something more frightening and difficult than the status quo? And lastly, can we relate to our addicts? I like this quote from Addictive Thinking, from Abraham Tversky. We polluted the air, rivers, and oceans for short-term gain, disregarding long-range effects. We've destroyed forests and other habitats of endangered species, with little regard for turning this world over to future generations. Are we not disregarding the future very much as the addict does? It's not hard to go very far to be able to relate to our addicted children. And if we have trouble, go to therapy, listen, ask questions, read, and reflect. Being able to see the similarities between ourselves and others, no matter how diverse their problems are, no matter how different on the surface they appear, that is one of the paramount signs of mental health. Seeing the differences takes very little talent and very little depth. Seeing the similarities takes strength and courage. It is the heroic journey inward. When we try to convince addicts of the fallacy of their thinking, it's like telling someone that his or her belief in the law of gravity is a delusion. It's the height of futility to expect an addictive thinker to abandon that concept of reality and accept ours instead. Addicts must lose faith, I love this, must lose faith in their current reasoning power, and they must accept the possibility of another version of reality from someone they trust. That's a profound leap for any of us. Very difficult leap to make. And oftentimes it has to come after this idea of rock bottom and bottom, just a bottom, something uncomfortable. For some people, that bottom can be very high. It can be being censured at work. It can be a DUI where nobody gets hurt. For some, it's prison. For some, it's an emergency room. For some, it's the 15th treatment. We don't decide it. We don't really even navigate it or choreograph it as loved ones. We take care of our side of the street and we turn over theirs to them. And oftentimes by taking care of our side of the street, taking care of ourselves, we make decisions that lead to somebody else's consequences and bottom. But we have to detach ourselves from that. We have to do it for the purest of reasons, for it to be the purest of interventions, of reactions. I love this quote from Tversky also. Similarities between the behavior of an addict and the behavior of a codependent are striking. Addicts are usually looking for new ways to continue to use chemicals while trying to avoid their destructive consequences. A person might drink alcohol or use cocaine only on weekends, or get a measured amount that will give the desired high, but not enough to result in intoxication. When the efforts at control fail, addicts do not conclude, I can't control my use. Instead, they tell themselves, that method did not work. I must find another method that does work. In the same way, this is the key, in the same way, codependents will not conclude that since efforts to stop the addict have been futile, there is no way of controlling the addict. Rather, they look for new ways that it will work. And Tversky goes on to say that so many of the same excuses that addicts have for entering treatment, for being open to treatment, are the exact same excuses as the codependent has for getting their own treatment. I'll talk about that in a little while. And here's one quote, another thing from Tversky. The mother of a young man who was destroying himself with alcohol and other drugs could not understand how he could be oblivious to the disastrous effects that the chemicals were having on his life. She asked for help in dealing with him. But she said, don't tell me that I have to put him in a house or that I should not bail him out of jail. I don't want to hear that. I responded, please tell me how much is 2 plus 2, but don't say 4. She had been able to see that her own thinking was no less distorted than her son's. And again, what I would say as a guide, a coach, as a therapist, is it has to be when you're ready, because the consequences are potentially devastating. So you have to own it, and you have to be ready. And you might not be ready in the same way that they're not ready. So I'll talk about the stages a little bit, just to run through these. I won't spend a lot of time on these. But the early stage of substance abuse disorder: cigarettes, smoking pot, and drinking are common. They might steal medication from parents. School problems begin. Maybe truancies, not come home when requested, staying out all night. Few consequences from their use. They have an ability to control their use, much more so. They start to build tolerance. The use is often social, fitting in. Right? They talk about it in terms of goals. Let me explain this to you. For an addict, and I've had this explained to me from addicts, they use when they're happy. They use when they're sad. They use to celebrate. They use when they're depressed. They use when they're stressed. They use when they're relaxed. So this early stage, you don't have those features. And that's one of the mistakes that parents get into asking about is what's causing it? What is it? The trauma? Is it the divorce? Is it the, where does it come from? And the answer is, for an addict, it doesn't matter where it comes from. That's why people in recovery often dismiss the value of therapy, because therapy in and of itself won't do it for many addicts. They need a program. I'll talk about that a little bit later. Attention span decreases, of course, lower tolerance for frustration. Oftentimes you'll experience addicts in the middle and early stages as more agitated when they're not using. Parents get confused by that. Problems in the peer group begin. In the middle stages, there are some attempts to limit use, blaming others for things that are going wrong. The types of drugs that expand. I will tell you that truism about entry-level drugs doesn't always follow course. It's been our experience over the past 10 years that some entry-level drugs are things like opiates. Right? They skip right over other drugs. Using instead of doing other important activities, withdrawing from family, friends, social groups, stealing and lying becomes more prolific. Academic or work performance declines, mood swings are more severe, increased time spent using substances. They begin to be more preoccupied with it. Conflict in the family increases. Legal difficulties start to show up. And of course, tolerance is increasing. In the latest stage, the late stage, the reactions from work and school are going to be more severe. Self-esteem is going to be compromised significantly. The physical effects or incidences such as blacking out or passing out are going to be more common. Withdrawal symptoms are more apparent, more visible, more obvious. They'll use alone. They start to experience more and more as they progress the need to use just to feel normal. Anger and conflict when not using is more severe. Denial, lying about their use is more common. Binging or daily use, of course. Stealing, dealing, or prostitute illegal activities. Weight gain or loss, high tolerance and withdrawal identifies with the culture and rituals. Again, that's kind of the progress, but the important thing is this. What's the difference between the approach that we might use based on whether or not we're in the early stage of experimentation or the late stages of addiction? And the honest answer is almost none. If their life is being effective or is unmanageable, we don't need to figure out where they are on this, and they're not going to be honest about it anyway. It doesn't even become important to us. In fact, you might be surprised to know this, but I've known it for decades, and I've seen it with therapists all over. After you're a few steps into therapy with a client, you actually forget where they are on the stage-like progression. You forget sometimes their substance of choice, their drug of choice. You forget the specifics of their consequences. You do that early questionnaire, that early accountability, right? You have them do an inventory, but after a while, you're treating the process. And you see this beautifully happen in groups. When children sitting next to children, young and older adolescents, sitting next to each other in a group will relate to each other, even though their substance abuse and addiction histories are dramatically different, if not 180 degrees apart from each other. Because it's the process. It's the same for us as codependent addicts. It's the process. The drug is irrelevant. Individuals who begin using drugs as juveniles are at a greater risk, so we are aware of that. The effects on the brain, this is not a webinar for that, but it compromises the brain and its structure and its development and leads to a greater likelihood of addiction problems later in life. I was asked on a panel years ago. It was for a young adult addiction conference I was sitting in. And the question was, how, if a parent came to you, the panel facilitator asked us all, if a parent came to you and said, you know, is my child addiction, and if so, an addict, and if so, how can I convince them? And my response was, you don't. It's not your business. It's not your business to convince your child. That's not your side of the street. But it is our job to provide your child with tools, with ideas, with experiences that allow them to more self-accurately diagnose. Right? That's our job. To put them in situations so that they can see the signs themselves and know what help looks like and even have a sense of what help feels like. But it's not our job to convince them or for you to convince them. And that just leads to a power struggle, and it leads to you as a parent or me as a therapist, because we do it too, to being a part of the addictive pattern in relationships. When a client tells me he or she is not an addict, my response is good. This approach isn't just for people who are already addicts, it's for people who aren't, who don't want to become them. In fact, I cannot imagine a better program, a better way of living than the 12 steps to ensure that casual recreational use of legal substances do not become a problem, or sex, or gambling, or any other addictive pattern. If we're living that way, it's like an inoculation against it. So again, I don't have to get into the power struggle. And I'm not making this up. It really is applicable to anybody, even if you've never touched a drug in your life. I wish, if anything, one of the gifts that I could give, and it's from a perspective of getting to watch people go through treatment who respond to it and have success later versus those that haven't yet responded. What does recovery sound like? What does evolving mental health sound like versus what it doesn't? What it sounds like is accountability, acceptance, and ownership. That's what it sounds like. It sounds like surrender. And what I mean by that is Phrases like, my best thinking got me here, or I need some help, or I'm open to what you think that I need, or yes, I would want to go home after a vote, but I don't think I can. It's not trying to sell or present to you a list of items that they need in their aftercare or their follow-up program. It's not that. It's not debating or negotiating. It's humility. It's asking for ideas and help from other people. I had one client years ago, the mother told me that her son said, my son doesn't like the word surrender, so we have to use a different word for it. And I said to her, I cannot think of a more ironic example of somebody who has not surrendered. If you need to come up with new words because those words trigger your son, he has not yet surrendered. Because you don't get caught up on semantics. You don't get caught up on the small brushstrokes. The parents, like I said, don't have to walk on eggshells and do everything just right. They don't have to imagine in their mind this architecture for this perfect intervention, this perfect letter, this perfect phone call, this perfect therapy session. Because if they do it right, then their child will respond well. They do their best and they let go. They try to do it honestly, assertively, creatively, courageously, and then they let go. Recovery is honest. Not a kind of, let me show you how honest I'm being, and I'm going to kind of come forward. It's a different quality of honest. It's here's what I've done, and then I'm doing it because I got to get off my chest, and it doesn't even matter if you don't believe me, because that's not why I'm doing it. And I'm not trying to earn trust. And that's the key. I'm not trying to earn trust. I'm not trying to impress you. I'm not trying to manage my image so that you see me a certain way. I'm doing this for me. I'm going to take a break just because my throat needs to clear. So excuse me for just a moment. I can edit that out of the podcast. I can't edit it out of the webinar. They do battle with shame and guilt. All right? They do a 4-step, a 5th step. They start disclosing things that they've done to people that have, and they do it because it's a burden. They do it because if they don't, it's going to kill them. They rely on groups of people and others for support. They need help. And they don't see that as a weakness. They see it as survival and maybe even as a strength. But at least as a recognition of what is real, that I need to other people. They find and look for belonging in the community. They don't talk about how everybody's different. They don't talk about how everybody's worse. They don't talk about how they're terminally unique. They talk about this community and how they get something, some wisdom, some insight, some support out of the most unexpected people and places sometimes. They take action. They do things. They don't ask you to pay attention to what they say or their new insight or the new epiphany or the new connection they made in therapy. They just do things differently. They act in service. They act in service of others. Right? Because it sustains them. Because it's necessary for them to consider other people and see other people. And of course, they work a maintenance program. They go to programs and therapy for years, decades, long after the last drink or the last drug. Again, I say this all the time. The reason I'm in therapy with this therapist for 20 years, not counting the ones before this, is because I'm in recovery. And I'm not going to be done, ever. That's going to be my life. And it's a rich life. It's not a weak life. Recovery is not self-critical. Recovery is liberating. It's open. What recovery doesn't sound like is blame, or it's not my fault, making excuses. It doesn't sound like I don't have a problem, or my problem is small. It doesn't sound like I can do this on my own. Or any variations of these things. It doesn't have anger and resentment in it. It doesn't come with a list of demands. It doesn't come, like I said, with a desire and an effort to manage what you think of them. It doesn't even care what you think of them. It de-emphasizes epiphanies and insight. It doesn't beat itself up. I'm a loser, feeling sorry for myself. And it also never complains, I am cured. I haven't had a drink in 20 years, 30 years. Recovery is for all of us. And for most of us, we have to bypass our shame to even consider the fact that we need recovery. But in my experience, my opinion, that comes with people who have developed great strength in this work. The self-deceptive features of addictive thinking and codependency have much in common. In both, there are often denial, rationalization, and projection. In both, contradictory ideas can coexist, and there is fierce resistance to change oneself and a desire to change others. In both, there is a delusion of control. And in both, there is invariably low self-esteem. Thus, all features of addictive thinking are present both, and an only distinguishing feature may be chemical use. And the same kinds of excuses that people use for not going to Al-Anon, for not doing their work as parents and family members, are the same ones that the addicts give. These people aren't like me. They're different. These people are more severe. Their family situations are more severe. I don't want to expose myself. I don't want to be weak. I don't need it. It's not my fault. I can't find a meeting, or I don't have time. Work is in the way. All the same kinds of excuses. So 12-step is what I've been talking about, but all of the core tenets of the truth that we use are in all of these. The 7 challenges, which is a non-confrontive way to help somebody look at their addiction and their problems. Harm reduction, it says, if you can do it less and be effective, do it. Doesn't mean I have to support the experiment, and eventually I'm not going to, but I don't get to decide if harm reduction or abstinence is your thing. You have to figure that out. That's not mine to figure out. I just get to figure out what I'm comfortable supporting. Refuge recovery is an approach using a Buddhist and a mindfulness approach. Very, very similar. I think all of the core principles are here. And in codependency, we need co-treatment. We need to take a parallel course. I commend those of you that are on the webinar tonight. We have a really long list tonight, which tells me one of 2 things, or maybe both. Number 1, a lot of people have children that are struggling with substance abuse, and they want to learn more about it. Perhaps thinking that if they attend this and then find the certain switches or levers to flip, that they can fix it. That could be part of the draw. Or it could come because so many of us know that we have a co-participation-like relationship with our child around substance abuse and addiction. And trauma and experiential, we know that trauma, we know it's related to addiction. We know that. And I'm not talking about acute sexual abuse, physical abuse trauma, or abandonment trauma. Trauma is anything that is less than ideal. It's poor attachment. It's having me, Brad Reedy, as a father. Right? That's the trauma that my children have. Brad Reedy is their father, and Michelle Reedy is their mother. And they're going to have to work out that trauma. And experiential therapy can help uncover that trauma and repair it. And my children, for their sake, will get into therapy. I will support them to get into therapy. They'll work at it, and they'll try to heal and take one step farther than I did from my family of origin. I had an interesting interaction some time ago with a therapist who I had been encouraging to try out Al-Anon or Codependence Anonymous for some time. And this is a parent, and she was talking to her brother, who's a in long-term recovery for alcohol addiction. And her brother said to her, she's my age or a little bit older, the brother said to her, you don't need to go to Al-Anon, you need to go to AA. You're an addict trying to control others. I laughed because I said to her, he does not know what Al-Anon is, because Al-Anon is for people who are addicted to others in all the ways that we can be addicted. Codependency is the purest form of addiction. And I think my experience, my observation tells me that codependency for most addicts is the core. In other words, addicts are codependents at heart. And then the substance becomes one of the ways that they medicate themselves against the pain or the anxiety of being in relationship with other humans. Take home. Focus on your disease. Learn what your side of the street is and stay on it, even with underage children. Do your work. Hold boundaries without arguing or convincing or being right. You don't have to do it perfect. Let go of that idea. Let go of the idea that you can perfectly engineer your child's recovery from whatever issue they're dealing with, addiction or not. Learn to hear and recognize what recovery sounds like. First in others, because that's easier, and then in yourself. Surround yourself with other people in recovery, other people that have done this work. Come to our parent support groups. Attend the webinars and listen to the podcasts. Read books from people in the field. Come to an intensive. Work some program. Make it a program. You know, my program is my program and it works. And it's every week. Don't argue or reason with a drunk. And I mean drunk literally, and I also mean it metaphorically. And in many important ways, all the important ways, all of your children are drunks, right? When they're in their irrational, crazy thinking. Doesn't matter what the symptom is. And take care of yourself. At the end of the day, folks, really this is about learning self-care. Learning to take care of yourself. Learning to nurture yourself. Again, I would refer you to the most recent blog on drbradreedy.com about how to discover a self. And really what role therapy or treatment for you can play into that. It really is an exercise in taking care of yourself. And then everything else falls into place in terms of the interventions, the decisions that you make with your children or with your loved ones. All right, I'm happy to take any live questions that have come in. As usual, you pierce the simple heart of the honorable truth. Surrender and recovery is for everyone. Yes, I loved talking about terminal uniqueness. I was at the Most Finding You seminar. Our new therapist, Claire and Emma and Alex, were an incredible team. The learning and insight I left with are life-changing. Huge gratitude. Thank you for sharing that. So happy. Can you please elaborate on the statement that addicts are codependents? Well, first of all, they're consumed with what other people think about them, right? They're uncomfortable with anxiety. And so what they try to do is they lie, they manage, they manipulate. That's what codependents do. Codependents have a nicer window dressing, but it's all manipulation, right? They're dependent upon other people in this kind of pathological way that leaves them feeling empty. And so while they at times can look more self-centered than the codependent, than the classic codependent, well, at times they can look more quote-unquote selfish, right? Underneath that or behind that is an overwhelmingly broken person who's trying to feel good about themselves. So the style of the addict doesn't look codependent. In fact, a lot of addicts and alcoholics think that Al-Anon is for weak people. We know that not to be true, of course. So while the style is more elementary, more it looks less evolved in terms of the way it relates to other people. It's still the same thing, still the same issue. And then, like this person I told you, I was dealing with an alcoholic in long-term recovery, a colleague of mine, 20 years in recovery, meetings every day of his life, hadn't had a drink in 20 years. And we were talking about relationships, and he said he was engaged, but he didn't want to marry her, but he was afraid to hurt her feelings. And I said, so wait a second, you're telling me you don't want to marry this woman, but you don't want to hurt her feelings. I said, have you ever attended an Al-Anon meeting? And he said to me, do you think it's relevant? Do you think it would help? And I couldn't think of a more humorous, but also sad example of codependency. Alcoholics, drug addicts are codependent. They just hide it better. And I would also say that classically codependent people don't realize how devious their manipulation and control is. They wear the halo, whereas addicts wear the devil horns. And they hide behind this idea that's really a mutated idea of their self-sacrificing, and they're really there for everybody else. They're the angel, the nurse, the rescuer, the knight in armor. But it's the same core issues. It's a lack of self. It's a lack of self. It's hard to know which to treat more strongly, the drug addiction or the mental illness, low self-esteem that drives them toward using drugs. I think for me, they ought to be treated concurrently. I do think, and I don't say this about everything all the time, I do think we do that better than most. The only thing I will say, some people need recovery regardless of how great the therapy is. And that person needs to figure that out. I need to be sober. I need to be attending 12-step meetings regularly. Doesn't matter how great my therapy is. Okay? So some people just need that. And for us to dismiss that idea would be ignorant. And I know many therapists in the world dismiss the idea. Conversely, there are a lot of people in the 12-step recovery world that would say the addiction is the thing, and they just need to be sober, and they need to go to meetings, and therapy doesn't help anybody. They will really say that. So I think if you take any stance where you exclude the other side of the equation, I think you're only working half the equation. And I use, as a therapist, which is what I am, I use 12-step concepts every day, all the time in my work. And I have clients that are in recovery who go to meetings and have a sponsor, and that's their thing. But they also have therapy. So again, it's one of those things that I wouldn't pull apart too much. A lot of people would say if the addiction is the thing that's going to kill them more eminently, then prioritize that. But bottom line is, there's no reason that either one of us have to be compromised in the approach or the priority. What is the difference between Al-Anon, Alcoholics Anonymous, and Families Anonymous? So Al-Anon is for the loved ones of alcoholics, but you can replace in their drug addicts or other addictions, or other self-destructive behaviors, really. Alcoholics Anonymous is for alcoholics. Codependence Anonymous is for anybody in a relationship with anybody who has self-destructive or unhealthy behaviors. And you don't even have to be, I mean, I can go to Codependence Anonymous because I'm codependent with my clients, with the mailman, right? Families Anonymous is more for families. So what you'll get is you'll get different emphasis of different stories. But the fact of the matter is, Al-Anon, Families Anonymous, and Codependence Anonymous are for those who want to think about their relationship with others. Alcoholics Anonymous or Narcotics Anonymous or Cocaine Anonymous, those are for those who want to focus on their substance abuse. But the principles overlap quite a bit. Don't be confused when you go into a meeting of Al-Anon and most of the people are the spouses of alcoholics. And you walk away thinking, well, that doesn't apply to me. If you learn to listen and hear, there's wisdom in their story. My relationship with my wife, of course, is different than my relationship with my 10-year-old. Obviously. But the fundamental truths and issues are the same. Next question. Our son has had an alcohol and marijuana use problem for 6 years. His abuse has led to multiple school, college expulsions, 2 total cars, loss of peer relationships, and goals for his future. We have provided him with multiple long-range therapies, starting with second nature when he was 18. He continues to deflect and deny that he has a problem. As parents, when do we accept that nothing we will provide will help until such time as he can see that he has a problem? Great question. Great question. You can take a stance. I was talking to somebody about this today. You can take a stance and say, I'm not willing to support you in this way. And then you have to ask yourself, what am I willing to support you with? And when you're done supporting with treatment programs, that's okay too. You get to decide what you're willing to support. For parents earlier in the process than you, for example, they might say more often, I'm not going to support you living independently or living in our home if you're not sober. So I'll support you in treatment, but I'm not going to support you outside of treatment. So I'm not kicking you out, but I'm supporting you in treatment. It's also okay, and you may be at that point to say, you know the principles, you know where there's an AA meeting. I'll support you with outpatient therapy, and you can find your own meeting. You can get to that point. You get to decide. There's no right answer. And I want to say this very clearly. No therapist in the world ought to tell you what to do, because the choice needs to be yours, because the consequences potentially are devastating. But you get to decide. And there's no right way. And there's no should. All right, that's all the questions for tonight. Thank you for joining us. My throat, sorry for my voice tonight. It was so excited that I was using all of it up. All right, we want all of you, if I haven't made this clear, we want all current parents to attend 6 12-step support groups, some combination of Al-Anon, CODA, or Families Anonymous. You can also go to NAMI.org for free classes and education in your area. All of these broadcasts are available on iPhone or on an iOS device, that's an Apple device, on the podcast app. Just search Evoke Therapy Program, subscribe there. Please share these with friends. We're getting about 1,000 listens a day these days. Or if you have an Android device or any computer, you can go to the SoundCloud.com website and search us there. Or you can download the SoundCloud app on your phone and search Evoke Therapy Programs. Follow us on Twitter and Instagram at Evoke Therapy. Facebook, search EvokeTherapyPrograms.com. You can find the Second Nature Alumni Foundation on Facebook. And of course, you can also to have up-to-date articles and content. My book, which is what I've been talking about in many ways tonight, The Heroic Journey Inward, the heroic journey to look at yourself and to be open to your work, is available on Amazon.com. The Journey of the Heroic Parent, also available through Audible, or you can buy a CD. The next workshop, we want all parents that are current, that possibly can, we want them to come to a workshop while they're with us. So the next one is January 20th and 21st. That's right around the corner. The one after that will be February 17th and 18th. Contact Gail at evoketherapy.com for more questions. Just as was testified a little while ago, the next Finding You is February 7th through 11th. We have some wonderful new staff, wonderful new setting for it in Park City, Utah. If you want to do deeper work, this is 6 or 7 individuals that want to look at and heal your own work, mindfulness activities, psychodrama, group therapy, art therapy, really, really good self-care. So if you want to make an investment in yourself, I highly encourage that. I've attended my own. Everybody in my family has attended their own, in fact. So the next one is February 7th through 11th. You can also schedule a private family intensive with me. Email intensives@evoketherapy.com or go to our website for more information. I'll be in New York on Monday night, 7 to 9 p.m. at the City University of New York. That's in Midtown. And then I'll be in Los Angeles on Sunday, February 11th. Make sure that you're getting these invites. You can also follow us on our social media to see these invites. Email Andrea at evoketherapy.com for more questions or to RSVP. Pursuits trips are high adventure trips, recreational trips for young adults or for families. Think sober light or therapy light. Sober Fun or Therapy Light. All right, any other last questions before I wrap up tonight? Should I keep encouraging my drug-abusing son to reconnect with his therapist? He has recently quit going, or is it something he has to discover he needs? He's 23. I think there's a risk. Great question. I think there's a risk when you use the phrase, should I keep encouraging him? I think if the invitation is clear, I think you get back on your side of the street. And make sure your boundaries around your son and your support of him are clear. Those are the things that are often going to encourage him to recognize that he needs help. The boundaries that you set, right? If his life is unmanageable, if you set a boundary about the way that he treats you, for example, you can't come over, you can't live here, whatever it is, those are the things that are going to inherently suggest to him that he needs help. But once you've made the offer, I think that you run the risk of anything more than a one-time or maybe a two-time invitation. Very good information session. Still struggling with some of the truths. Struggling, but they are truths or just early opinions. So can early premature labeling of an addict, if not totally true, be harmful? How to avoid? I don't think so, because again, we don't care. As a therapist, I don't care. I don't care to make that distinction. Parents want to know exactly where the child fits, but I don't really care. So again, from the recovery standpoint, from the psychological point of view that I'm talking about, the spiritual point of view that I'm talking about, it doesn't matter. Your response is, I'm not comfortable with what I'm seeing, and this is my boundary. If you're under 18, I'm sending you here. If you're over 18, you can't live with me and do that, and I'm willing to support you in this way. So it's not to put a fine point on the specifics of the diagnosis are not necessary in order to set a boundary and to offer and suggest help. Great question. All right, folks. I'm going to talk about what to look for in a therapist. It's actually something I think about all the time, and I've written 4 blogs about on my website, various ways, but I'm going to talk about it a little more in depth. And this can be your own therapist, but it also can be a therapist for the family, because a lot of people want to know what to look for in a family therapist. So I'll be talking about both next week, Thursday, January 25th at 7 p.m. Mountain Time. Have a great week. Look forward to seeing some of you in New York this weekend, and I hope these point of contacts are helpful. Good night. Bye-bye.